So we wanted to ask you some questions about what EggPath has been doing during the coronavirus crisis. It's going to hit Africa pretty hard, we know, in the next few weeks, and wanted to find out what EggPath is doing in the field and how we're working in our 19 countries. Can you tell me what we've been doing?
I can, Craig. Good to see you and be with you in this way. We're doing a lot, and we're doing a lot in tandem with each one of our countries as well as our headquarters team. As everyone knows, this is just really a unique sort of common assault on public health, the coronavirus. Every country's facing it at one stage or another at the same time. So we're doing some of the things that are most important for EggPath. First and foremost, how to keep our staff safe. At the end of the day, our mission is to end AIDS in children, and we do that by serving communities and families and partner with ministries of health and so on. We've got to continue to do that and at the same time keep our staff safe. So that's our first priority. That takes different forms in different countries depending on where the virus is in those countries.
Maybe you could talk a little bit about how does the coronavirus crisis really impact our services?
So the sort of first concern, of course, is to reduce the spread of the coronavirus. And I think a number of African countries have seen what's happened in Asia and in Europe and North America. I think they've taken early steps to close down, so people are working from home. All of our offices are closed, meaning they're not in the office, but they're working from home. And yet quite a number of our staff are essential staff. They have to continue to go to sites. And so how do you strike that balance between safety and continuity of services at a high quality? People that are HIV positive need their ARVs on a monthly basis. So how do we move to providing a number of months of supplies? Is there adequate supply of ARVs at that site in the country in order to do what's called multi-month dispensing? The testing for HIV and AIDS is going to be interrupted where there is surge demand at health sites. You want to keep different patients with different symptoms or conditions separated. You don't want someone with COVID symptoms waiting in a line or among a group of people who are there to get their HIV services or their tuberculosis services. So there are major changes and adjustments that have to be made at health sites. So there are immense challenges, but that's what we do. That's what our colleagues know how to do. And that's why they work at EggPath, and that's why they are going to continue to go to sites. But our job is also to make sure that they can do that safely.
What can we do as individuals to help with this response, to help with COVID-19? I know I'm at home, you're at home, and it can be very overwhelming. What can we do to help?
We're at a time when resources will save more lives. We're also, though, talking about communities that by their very nature and condition right now have less well-developed healthcare systems and are under-resourced. So as people are inspired to help in their own communities, I hope people will give a thought to and possibly support the work that's being done in other communities that are hugely challenged by this. Are still on the front end of the coronavirus. And there's a lot that we can still do and are doing every single day.
Thanks so much for talking with us, Chip.
I'm happy to, Craig. Thank you.
If you would like to help EggPath during this critical time, you can give by visiting our website at www.petaids.org/COVID response. Thank you all for tuning in, and thanks for all the support.